Good afternoon, friends. Today I want to explain something about chest pain, cardiac, whether it's a cardiac problem or any other problem, which is commonly faced by almost in every house. Sometime or the other, this dilemma occurs. Uh, the moment you get a chest pain, patient's feeling is whether it is a heart attack or a heart problem. And this is becoming more and more of concern because youngsters, due to the, start developing this fear and then end up doing hundreds of tests and then paranoia, lot of things we are seeing. So I'd like to first start with telling that the heart is inside. The heart is inside, it is covered by lung on this side, you've got the heart here, and a part of the lung, the left side lung has got one lobe less so that it accommodates the heart. In front of the heart, in the sides, you've got the esophagus, in the middle. Esophagus is the tube going from for swallowing to reach the stomach. You'll have to remember this very well for you to understand what I am telling. Then, of course, you have got, when you come from inside, outside, you have got the muscles, the ribs, the muscles connecting the ribs, intercostal muscles. Then you have got the cartilage. Cartilage is the soft bone which is connecting the main bone to the ribs. And then you have got the skin. So, any of these can cause pain. Problems with these can cause pain in the area of the heart. So one has to be very clear when you, that is why we say history taking. When a doctor asks you how is the pain, is it a burning sensation or is it a pricking sensation you're feeling, or is it a sort of a vague pain, or is it compressive in nature, or is the pain radiating somewhere? Is there any associated sweating when you get the pain? So when you move, does the pain increase? All these are very important in clinical diagnosis of a problem, not only cardiac, any disease. That is why talking to the patient gives you the diagnosis almost invariably in most cases. See, what can happen is, I'll give an example of a typical cardiac pain. Typical cardiac pain in a non-diabetic individual. A diabetic individual, pain can vary because the nerves are affected. You might not feel all the symptoms which I'm going to describe now. A typical cardiac pain, what happens is, the patient says that sort of vague discomfort, sir. Something here. Or if it is severe blood supply diminution, they say that severe compressive pain is there, sir. And then from there they say it's going to the shoulder and then coming down the inner side of the hand and to the last two fingers. This is a typical cardiac pain. It is like a throbbing pain. It goes slowly, chuck, 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 it goes to the hands. And then it can go to the angle of the jaw because the nerves supplying the heart supply these areas. So when that is affected, heart is affected, this sort of typical pain, vagueness, vague pain here, compressive pain here, and then going to the shoulder and down to the fingers, last two, medial two fingers, to the angle of the jaw. This indicates probably it is cardiac. And then there can be associated sweating. Then you can have palpitations and giddiness, sometimes associated vomiting. So if these features are there, then you'll have to think that it might be a cardiac problem. But whoever is near the patient should not tell this is a cardiac problem, it will frighten them more. The BP will increase and the blood supply to the heart will get still worse. So reassurance when this sort of symptoms is there, don't worry, it is this thing, but then intervention, what to do. This is very important. And when you look at a diabetic might not have these typical symptoms. That is where it becomes confusing. When you tell most patients are diabetics, then they say that a vague pain or a discomfort itself can be cardiac. But then you have done your test, you have done your ECG, treadmill, everything has shown normal. Suddenly you get a pain. It is unlikely to be a cardiac pain. It can present as a vague pain, discomfort alone. Sweating need not be there. Autonomic neuropathy, what we call in diabetes. And the typical symptoms might not be there. So in a diabetic, especially an elderly person complaining of vague pain suddenly, it is better to have an ECG done. If all the tests have been done, treadmill, everything has shown normal, probably an angio is cleared, then I don't think there is need to worry, because I'll explain why other causes can be there. The thing is, with this cardiac pain which I described now, this pain is aggravated by exercise. That is, the patient starts moving, walking around, this pain, compressive or a vague uneasiness increases. And when you take rest, it comes down. So this has to be, it is aggravated by movement or action and reduced by rest. That is why we say, don't strain, let it be. Because when you move, the work on the heart becomes more, blood supply reduces more. Probably if you have an anti-anxiety pill or something, ideal to give. And then immediately get to a hospital. But then you will have to remember, other causes of chest pain are more frequent than cardiac pain. The most commonest being a gastroesophageal spasm. Esophagus goes down to the stomach, as said. What happens, especially in diabetics, the stomach is full most of the time. Most of the diabetics will say, sir, I don't feel hungry at all the time. I feel like eating when I go, a little I eat, I feel full. That is because the stomach, the food doesn't get moved that easily as in a normal person. And then this food, there is a regurgitation. It can regurgitate up. What happens from the stomach to the tube, the food is pushed up, the acid also goes up. It irritates the esophagus, spasm. When the esophagus, the tube connecting the stomach, I told, when acid or whatever goes up, natural, like somebody comes to hit you, you stop. So this goes into spasm. That spasm can cause a typical pain, like I told, sort of compressive pain, spasmodic pain, they'll say. So this is a very common thing. I'm not telling neglect. I'm telling you'll have to think of all this, especially in somebody who has been proved ECG, everything is okay. Most common is this. And commonest cause of esophageal and other gastric problems are, as we were taught, hurry, worry and curry. All these increase this thing, acid secretion, reflux, and this reflux can be a common cause of dry cough, what we call dry cough syndrome. It comes up, hits on the throat, especially when lying down, elderly patients, chronic cough. That's why we give something like domperidone or something along with the proton pump inhibitor so that it doesn't come up and cause this cough. One of the causes of chronic cough is this gastroesophageal. The other thing is muscular pain. There can be muscular pain. Those doing regular exercise, walking, bike, this thing, there can be a spasm. This pain will be localized to one area. When the patient, you ask them where the pain is, they'll point out like this. When somebody points out to a particular point, it is called pointing index. My doctor friends would have read in their medicine. Pointing index is not cardiac. When somebody says typically 1 point, it is usually 99.9% not cardiac. Cardiac is vague. And then this area, unlikely. So this you have to remember. This again, this muscular pain can be aggravated by exercise, by movements, those things, because the muscle is being stretched. So that is another cause. Bone causes, what we call Bonham's disease, very often caused by a virus called Coxsackie B virus. This virus remains usually around the second rib. It remains there, lingering there, and then that can cause severe pain sometimes in that area, but that is localized. You don't have other symptoms. So this is another thing. The other thing will be a skin pain, neurotic pain. When you look at, I've seen patients telling pain, looking there, you've seen there is a herpes there. Herpes can cause a burning sensation. So when you ask the patient whether it's a pain or a burning sensation, if they say it's more of a burning sensation, it's most probably gastric. So gastric, muscular spasm, gastroesophageal spasm, and the other rarely skin disorders are more common than cardiac, especially in youngsters. Elderly people with diabetes, hypertension, other things, when they say vague pain, if you feel that they have not done their test before, not checked up the ECG or anything like a routine mastoid checkup, which is advocated, not done for a long time, then you will have to have concern. Don't frighten them. They've got to go to the doctor, see, and then follow up. So these are some things which are very important to for a patient to know. Not to panic. Pointing index, not cardiac. Burning sensation, usually not cardiac. Vague pain and then associated sweating, giddiness, vomiting, radiation to the hand, jaw, all this probably cardiac. You should have a look. And follow what the doctor says. And like I said in the last thing, doctor-patient relationship is very important. Talk to your doctor. Sir, could it be some other reason? ECG is normal. Do you think I need to take a treadmill? Especially if you're after 40, with the diabetes, with hypertension. Ensure that both are controlled. This is very, very important. Risk factors need to be controlled to prevent all these. So, with this, I want to make video short, otherwise it naturally becomes boring. So, this I feel is something which is very important for patients to know, but don't be complacent. If you have got a doubt and then still fear, don't hurry, but have a test done, especially after 35, 40, have an ECG done. There is no point in hurrying, worrying, raising your BP up, raising the BP of all people around, and somebody might have a cardiac problem, your father or someone, their anxiety, they will get into some trouble. So the thing is, calmness. Don't panic. Things will be okay. So I hope this has been helpful to you in some extent, but use your discretion when the symptoms occur. Wish you good luck. Wish you all a fantastic year.